Hey there, I'm back with another video, and today we are going to do knee pain. Musculoskeletal system is very important, and any joint pain or limb pain is very important for the exam because it's very easy for the SP to mimic, and it can seem a very little bit intimidating, but it's very simple when we come to think about it. As usual, we are going to follow the pattern. First, the differential diagnosis, and second, the questions to ask under knee pain. Let's go ahead. All right. So the first diagnosis will be OA, osteoarthritis. That's the first thing that we remember. Whenever we think about osteoarthritis, the second differential that we think about is rheumatoid arthritis, and it's very important for us to differentiate between the two. Next, we have septic arthritis. It usually presents with swelling in the knee. So septic arthritis can be either gonococcal or non-gonococcal. We should also think about the systemic symptoms. And then if they have fever and rash, then it can be disseminated gonococcal. And then after osteoarthritis and septic arthritis, then when we think about septic arthritis, please also think about reactive and psoriatic arthritis at the same time. Next, we think about in pairs, gout and pseudo gout. Okay. And then we have domestic violence, Lyme. And then finally, we have, when we think about RA, we think about SLE also because it is systemic, and that is our thought process. So first, OA and RA, then immediately septic arthritis. When we think about septic, we think about reactive and psoriatic. RA leads us to think about SLE, and then you have gout and pseudo gout. And I remember as if there is an insect bite, I'm sorry guys, if there is an insect bite, then it is Lyme. But if a human has bit you, then it is domestic violence. Okay, humans don't bite, but if they beat you, it is domestic violence. And if an insect has bit you, it is Lyme's. That's how I remember it. So this here is the list of differential diagnosis for you. The same thing. Now, what are the questions that we are going to ask the patient? First set of questions is this. First, talk about the joint. When the patient is coming in with knee pain, the first questions that we have to ask, the set of questions that we have to ask over here are these. Pertaining to the joint. So it's going to be warmth, redness, swelling, stiffness, any popping, and then down the leg. Once this joint is over, then we ask about what is down the leg, what are the symptoms that you have. So that is weakness, numbness, and tingling. Once this is over, think systemic. If all these symptoms are present in any other joints, do you have any of these symptoms in any other joints? After that is over, the mnemonic that we followed for abdominal system was FIT. So I want to stick with that for ease. So when we talk about FIT, here it's fever, fatigue, and chills. I is for insect bite, and T is for travel or trauma. Okay. Then let's go down, and there is chest pain, cough, conjunctivitis. You can remember as chest pain, cough, conjunctivitis. And then rash, because we are thinking about SLE. Then remember in abdominal system, we did FIT, FIT, and then we quickly moved on to bowel symptoms, then urinary symptoms on one side and nausea and vomiting on other sides. So after FIT, please remember chest pain, cough, conjunctivitis, and shortness of breath. After that, there is U for ulcers, urinary discoloration, B for bowel symptoms, and we can ask for diarrhea because that can be reactive arthritis. And another D is domestic violence. And in domestic violence, we do the mnemonic safeguard in order to screen for it, which is already covered in the video of general mnemonics. So the safeguard over here stands for, do you feel safe at house? Are you afraid of the one who's who's taking care of you? So in case of elderly, we'll ask if your son, are you afraid of your son? Does anyone in your family know about it, or does he hurt anybody else in your family? Do you have a safe exit plan? Do you have guns at home? Is your son an alcoholic? How is his relationship with others? And do you feel depressed or sad? Okay, this is the thing. So this is systemic. This is pertaining to joint. And this is systemic. So since we have seen this, let's see this. I always, it's better to either stick to this mnemonic or start with the head and neck and then go on to this mnemonic which is present over here. So when we start from the top of the head, it's hair loss. It can be present in females with SLE, or it can also be hypothyroid if the person is presenting with multiple joint pains and also has fatigue. So you can put hypothyroidism as a differential diagnosis. So hair loss, conjunctivitis can be reactive arthritis, and then we have photosensitivity and oral ulcers here. Photosensitivity and oral ulcers, which is here. And then we ask for cervical lymphadenopathy and then any discoloration of fingers. So this can mean Raynaud's. Okay, so this is the mnemonic. First, ask questions pertaining to the joint, and then go systemic. Here. And the specific questions I've written over here. For OA, it's going to be popping sound. Which we'll cover in warmth, redness, swelling, stiffness, and then popping sound. And for rheumatoid arthritis, we are going to remember stiffness. And please ask for symmetry. Do you have the symptoms in the opposite limb as well? And we are going to remember stiffness and symmetry, but we often tend to forget systemic symptoms. It's very important, and one of the diagnostic features that RA has systemic symptoms. When we talk about SLE, think about SLE, especially if it's a young female between 28 to 35 years of age, if she's complaining of fatigue, anorexia, fever, and recurrent abortion. So it's very important for us to take OBGYN or menstrual history. And then they can also be Raynaud's phenomena or discoloration of the fingers. We ask about insect bite. Like I said, insect bite and human beat. Insect bite can be Lyme. This can be covered in, you can ask a direct question. Do you reckon being bitten by an insect, or have you traveled? Then septic arthritis, gonococcal and non-gonococcal, we can ask the sexual history. Next, gout, the patient will give you, patient will give you the history of swelling in the large toe, or you can ask for it if the patient doesn't say. And then when it comes to reactive and psoriatic arthritis, you will have urinary and GI complaints, which is covered in the mnemonic. And then psoriatic arthritis, Samuel pink and scaly rash will be present either on the joints, or they will be a family history. That's all for knee joint. I hope you found this beneficial.